Advisors to the World Health Organization are considering whether to suggest new guidance for the public on wearing face masks. It comes after new research suggests that coughs and sneezes may project particles much further into the air than previously thought. Here's Dr. Chris Sapala, Federal Vice President of the Australian Medical Association. Hi, Chris. So what's your reaction to this possible change of advice by the WHO on masks?
I think we have to watch the evidence very carefully. It's obviously emerging quickly and on a day-by-day basis. The Australian Medical Association remains quite comfortable with the current advice around use of masks, etc., and limiting surgical mask use to largely healthcare facilities and, of course, people who are unwell. But clearly this is a rapidly changing space, and we just need to, with our epidemiologists and our healthcare workers, keep up to date with the evidence and be prepared to shift our guidance if that evidence suggests so.
Yeah. Mask numbers aside then, Chris, if it is found that particles from coughs and sneezes do travel further than previously thought, then it would be prudent, wouldn't it, for people to wear a mask in public, not only to protect themselves from others, but to keep their own germs to themselves?
I'm not sure that we are in a position to confidently make that call. I mean, if we look, for example, at work that have been done in COVID wards where air sampling has been done, there is no viable COVID virus in the air of those wards. There's no viable COVID virus in the hallways outside those wards that people might have traipsed out with them when they were walking around. So there's a whole mix of evidence, as I say, that needs to be taken into account, and it is being considered. The other thing to remember about surgical masks on well people, because remember, on a sick person, that's fine, but on well people, is there is a concern it gives a false sense of security. A huge number of people wear those masks improperly. So they take them on and off, they touch them, they don't change them after a few hours, they don't change them after they're soiled or when they get wet, and all of those things make the mask useless. And so I think there is a danger by using the masks improperly that they give a false sense of security. So please, let's wait until we know for sure what the evidence is telling us about this virus, and then we can make the appropriate recommendations.
OK, just staying on the reasons for wearing a mask in public, though, for now, Chris, a study of the transmission of SARS, also a coronavirus, in Beijing in 2003 found that, and quote, always wearing a mask when going out was associated with a 70% reduction in risk compared with never wearing a mask. That's pretty hard to ignore.
On the surface, it looks like that might be the case. But if you actually read that study in detail, there was, for example, in the case group, so in the case cohort, there was significantly greater numbers of patients visiting fever clinics. And visiting a fever clinic in China when the SARS epidemic was on was associated with a 13 times greater risk of getting the virus. Having a chronic medical condition was associated with a 5 times greater risk. And again, those patients were significantly overrepresented in the case group. So, like all evidence, we need to look very carefully at it, look at the methodology and exactly what it's telling. I agree, it absolutely needs to be considered, but that trial you quote is a long way from a slam dunk that there should be wholesale use of surgical masks among well people in the community. And I think it's important that we reiterate that at this stage, the recommendations against that remain appropriate and reasonable.
And overall, Chris, how successful are we being, in your view, in social distancing measures and self-isolation from what you've seen of the infection rates?
On the whole, I think we're being pretty good. You know, Australians are heeding the advice, and we're doing not too bad with our social distancing. We always have room to improve with our hand washing and so on. And they're the things that are going to beat this virus. Those basic things on a behavioural level that we do every day. There is room for improvement, as I mentioned. And so anything that we can do to be meticulous with that in our workplaces, in our homes, for example, our cough etiquette, that remains the most important thing by far, and that's how we're going to beat this coronavirus.
Dr. Chris Sapala, thank you.